March 19, 2020, Governor Tom Wolf ordered all non-life-sustaining businesses in Pennsylvania to close to slow the spread of COVID-19. On March 22nd, the Department of Health issued new guidance stating that dental offices could only operate with required PPE, negative pressure rooms, and special HEPA filtration. Immediately, Pennsylvania Dental Association leadership went into overdrive to advocate to get these unpractical restrictions lifted from the Department of Health and Governor Wolf, and consulted with legal counsel to find out what options we could pursue.
Department of Health continually changing our guidelines and what our licenses were restricted to. It's very helpful having that. Not everyone has the time to sit there and watch Governor Wolf or Dr. Levine on TV to listen to their press conferences, but the PDA was great in sending us updates to the guidelines from the Department of Health. So I thought that was really nice to see. They were very good giving us a voice, especially for everyone who was just kind of bearing with what we were given. So PDA was nice from that aspect.
On March 26th, the Department of Health revised its guidance after listening to the concerns of the Pennsylvania Dental Association. Emergency dental care can now resume with appropriate PPE, but we would no longer have to have negative pressure rooms, which were absolutely not available in dental offices, hospitals, public health facilities, or dental schools.
March 23rd, when the Department of Health said that we cannot operate our practices unless we had a negative pressure room, which essentially closed dentistry down across the state of Pennsylvania. There were very few negative pressure rooms. And I was on the verge of renting all the equipment to create my own negative pressure rooms in all my offices, 3 different offices. And we were ready to pull the trigger on that. And on Friday morning, I think, or Thursday night, the 26th of March, the PDA was successful in lobbying the Department of Health and enlightening them as to what the ramifications really were for our patients across the state of Pennsylvania, that we didn't at least have to have the negative pressure room. So that was, an example of how the PDA jumped in very quickly to at least allow the door open for emergency patients. Otherwise, they were going to go to the ED.
PDA has been working very hard on COVID-related legislative issues for all of us. PDA is supporting Senator Brooks's legislation in the Senate and is asking for help from Representative Boback in the House for civil liability immunity legislation. This would help our healthcare workers who have been providing care for COVID-19 related patients. We are also advocating for PPE. We know the Department of Health right now does not have the PPE to provide for us, but we are number 4 on FEMA's list, so we are continuing to advocate with our legislators to help us gain that PPE. PDA is also exploring a very exciting opportunity to introduce legislation to provide dentists with the ability to order and administer diagnostic and antibody testing. This would include COVID testing. And lastly, we are continuing to advocate with our third-party payers and medical assistance providers to help increase reimbursements to dentists to provide for PPE coverage, better coverage for adults in general, and advance payments for providers. PDA is working hard for you.
Well, let's face it, the currency of choice during a pandemic response, the most critical thing is information. Everybody was craving more and more of it. And we had very valuable information to distribute to our members. The thing was, not everybody always knew how to find it.
Really what began to happen is just multiple sources of information that were coming at us from every different direction. It could be opinions of colleagues, it could be blogs, it could be websites, it could be our supply salespeople, and it was overwhelming, but you quickly understood that the place to go to get accurate information was through the PDA and the ADA. And to date, that's all I do. There's just too much information coming from different sources, and you knew that the information you were going to get was accurate. And I think my colleagues all feel the same way.
We used our PDA Go mobile app, which was a great tool for us during this pandemic, and we really were able to take advantage of PDA Go. We also used our website. We, of course, did multiple email blasts to our members every day, and we used our social media pages.
get out, and we use a lot of different vehicles. But a lot of our district and local leaders who might otherwise have gotten information from attending a meeting, well, they weren't meeting. So we took a page from continuing education and looked at what the ADA did and decided to develop webinars as a way to kind of bridge that gap and get re-engaged with our district and local leaders. The nice thing about the webinar, besides the fact we kind of knew how to do them already and could do it quickly, it's interactive. Gave them the opportunity to dig deeper and ask all the questions they needed to ask, to be fully informed about the issues and how to get that information. And ultimately, this had a lot of value for our members because those leaders then shared with their colleagues and they were better equipped to do so.
Every day was confusing. You weren't really sure what was going on. There was so much misinformation out there. And what I want to do is just thank the PDA, ADA, our PDA leaders, Jim, Charlie, Linda, and the whole entire board, and especially the PDA staff. The communications we got from them during that time was a lot of misinformation between PDA Go, the email texts that we were getting, alerts, text messages. Anything that was coming out, we knew it was been vetted by the PDA, it was accurate. That was important because every day you opened up the paper or the Facebook or social media, there was something that wasn't right.
When the governor suspended the restrictions that limit the number of CE credit hours licensees can earn online or through self-study, PDA added 9 online courses, including sessions on treating special needs patients and understanding medical marijuana. PDA plans to offer more virtual CE courses, including lectures to fulfill mandatory CE requirements. Visit our website to register. PDA is a resource for CE, an advocate for the profession, and we will continue to keep you informed on any changes to the dental regulation.
With a worldwide shortage of PPE and prices skyrocketing, something needed to be done to help members. The Pennsylvania Dental Association created and led a task force to secure KN95 masks and had them fit tested, which resulted in PDA's member-only program offering mask and fit tests so our members could start treating emergency patients again. The PDA Health Crisis Task Force was then formed. This is a team of volunteer leaders, staff, and consultants who nimbly respond to all COVID-related issues impacting dentistry. In addition, we worked with the 3 deans from the 3 major dental schools in Pennsylvania, the Pennsylvania Academy of General Dentistry, the Dental Hygiene Association, and the pediatric dentists. In this case, this whole entire group was involved during the pandemic and represented the dental profession and patients and was the driving force to convince the Department of Health to rescind its initial guidance and allow dental offices to treat emergency cases while most businesses continued to be shut. The task force continues to play an instrumental role in working with government officials and others to secure more PPE supplies for dentistry, expand on immunity for dentists, allow for dentists to order and administer COVID-19 tests on patients, and enact third-party payer policies that provide financial assistance for dentists struggling with increased costs of providing care. The task force is working hard to make sure that the Pennsylvania Dental Association becomes your trusted voice for dentistry, and we encourage all of you to join the Pennsylvania Dental Association to help us in that matter. We are the voice of dentistry in PA.
N95 mask. Everyone knows the PPE shortage that were going on. The test, the mask fitting, the test fitting, and being able to at least go in and treat our patients, our emergency patients, was a true blessing. So thank you so much to everyone at PDA, and it really makes you proud that you're a member. I want to just say a final thank you and especially call out the Director of Membership, Mary Donlin. As everyone knows, she was the acting executive director during that time, and all of a sudden her staff was scattered all over, working from home. It's hard enough to run a PDA staff in the building, let alone spread out and during a global pandemic. So thank you so much to Mary, and thanks to everyone for everything that's done. So hashtag PDA strong, hashtag PDA proud.